The first case scenario in black, the green is the normal one. आ जाओ बेटे, मेरी समझदार बेटी, यहाँ आ जाए। ये मेरी सबसे बड़ी बेटी, इधर आओ। ये क्या हुलिया बनाया हुआ तुमने? मैंने मूड हुआ है ना, अभी नाश्ता किया। ये मेरी सबसे बड़ी बेटी, मेरी जान है ये, दुआ। ओके। है? अभी मैंने आपकी रोटी ले लूंगा, अभी अब चुप कर जाओ। ओके, बस इतनी बात, इतना ज्यादा फ्रैंक नहीं होना। ओके, नाउ look, this was the isotonic case which we have studied, the one in red. 0.9% normal saline ringers, Hartmann's, dehydration, fluid displacement, burns, vomiting, diarrhea, not to be given in hypertension or heart failure. And the only thing which happened was increase in extracellular fluid volume. Now we come to the next one. Here, focus here, on this side of the screen. You can see my pointer?
Yes, sir.
Now look here, what is happening is, this is the extracellular compartment, this is the intracellular. Now the solution we give here is hypotonic. You just see it here, hypotonic. And hypotonic is any solution which has an osmolarity less than 0.9% sodium chloride. Sahi hai? And major solutions which we use is dextrose water, which is in the market, it is in different preparations. It can be 5%, 10%, 25%. Either of the case, it is hypotonic because dextrose or glucose does not impart any osmotic pressure. Glucose or sugar, the table sugar, it does not give osmotic pressure because it does not split into ions. Or the other option we can give is distilled water. In market, you may have seen a few solutions, a few injections which have a powder separate and a small water vial is separately supplied. And if you just try to read it out, it is written distilled water for injection. That's all. It is distilled water, not tap water. Obviously, you cannot just wish to give tap water to your patient. Major uses is nutritional. So we come here, we give it in the extracellular space. Now we do not have ions or proteins to govern the movement of the water. We will give water here in this compartment. It will move here and it will obviously go here. Is it like that? It will be equally distributed. Just imagine a bunch of students with no teacher, no vice chancellor or principal. They are free to do anything. They'll go everywhere. Like some, क्या मतलब सो रहा, ठीक है? I guess it's clear. But it does not have ions. Then it will go here. It will have a dilutional effect, making the osmolarity come down. Not only of the extracellular compartment, but also of the intracellular compartment or intracellular fluid. What do you say? Is it clear? बच्चों बोलो।
रिपीट करने।
बेटा देखो, जब हमने पानी दिया, सादा पानी, there is no ion, there is no protein. Water will move here and water will move here as well. It will move in both of these compartments equally. So as a whole, the volume will increase here of the extracellular compartments. The volume of intracellular will also increase, but because it is diluted, the osmolarity of both compartments will decrease.
Okay,
now, when we should give it nutritional, majorly given for nutritional purposes. For example, a patient is on nil per oral. They have heard the word NPO. NPO we say nothing per oral or nil per oral when the patient cannot eat anything. So he needs glucose, so we can just give this solution. But when not to be given, a very clear stance you should know in head injuries and cerebral edema. Just look. Now I'm going to tell you one thing. What if you get an infection on your hand, on your face, or any cut, or any sting bite of a bee bite? What is the major thing you see? Inflammation, swelling. In all of our body, there is a general plan that the bones are inside and the soft tissue is outside. And the soft tissue has a lot of liberty that it can expand. For example, if a hand swells, it can swell. But there is one thing in the body in which the theme is like that the bone is outside and the soft tissue is inside, which is the brain. And the brain does not have any space to expand. Okay? So if this water expands the intracellular compartment as well, if a patient is having head injury and edema of the brain, cerebral edema, what will happen if we give this fluid to such a patient? His cerebral edema will worsen and the patient can even die. Or the coma grade, the unconsciousness of the patient will become severe and the output of the patient will become worse. Did you get it?
Yes, sir.
I hope so it's clear. Even if it is not, I'm always here to answer. Now, we come to the third case scenario. Here. Now, what we are giving a hypertonic solution. Again, the access is in the intravascular area. We can just give it here. What will happen to the extracellular compartment volume? Just think. It will increase.
Increase.
And the osmotic pressure will increase as well. Because the solution we are giving is hypertonic and it has an osmolarity more than 0.9% sodium chloride.
Yes.
Clear? Now what will happen? Across this cell membrane, a lot of things will shift. Because this solution which we gave in this space as a whole is hypertonic and it will hold the water. And now the osmotic pressure of this red area is more than that which is in the cells. Did you get it? So this increased pressure will pull water from the intracellular space towards it. And water will move in this way. What do you say? I need an answer. ओ बच्चों मर गए चलो कोई बात नहीं देखो by giving this solution the osmolarity here will increase. Can you follow this red arrow? Osmolarity increased, so water will move from here to here. Very simple. Now this blue cell membrane will act as a semi-permeable membrane. Because the extracellular space has increased osmolarity, water from inside the cells will move outside. Clear? Yeah. Now, this will cause a further increase in this volume. This volume will even further increase. एक तो पहले बढ़ा, जब हमने फ्लूइड दिया उससे बढ़ा, अब और वाटर आने से मजीद बढ़ेगा. And there will be a reduction on this in this volume here. And when, now just look, just stick to my question. If only water is moving from this area, if only water is moving out from this area, what should happen to the osmolarity? If only water is moving out, the osmolarity here should, yes, very good, increase. Now I guess it's clear. So all of this process will drag a lot of water from the intracellular space and move it towards the extracellular space. सही है? hope it is easy now. And now the example here of this solution is mannitol, which is given in routine. And what will happen is extracellular fluid volume will increase, extracellular osmolarity will increase, intracellular osmolarity will increase. However, intracellular fluid volume will decrease. Now, when will we give it? We will give it in a case to decrease the cellular edema. When you wish to decrease the amount of water in the cells, should it be like that? बेटा अजान को भेजना हाँ. So we gave it in that case when we were not giving this solution, this black one. We gave it in head injury. Glaucoma is an increased pressure of aqueous humor in the eye. Cellular toxin, such a toxin which is inside the cell, we just wash out the cell. Obstructive jaundice, when bilirubin is present inside the cells, we just take it out. In all of these cases, we are just washing the cells and moving the water from inside the cells outside into the blood. And when the blood volume will increase, this extra water will be lost through the urine. So that is why we say hypertonic solution as an osmotic diuretic. What do we say? Osmotic diuretic. Diuretic is a solution which increases urine output, and an osmotic diuretic is a solution which acts on the basis of osmolarity. बेटा इधर आओ आपको एक चीज दिखाऊं. गाड़ी दिखाऊं गाड़ी. हाँ गाड़ी इधर आओ. इधर आओ. यार कितना भागता है. और तेरी खैर मोटा. ये देखो ये मेरा बेटा है. This is my अजान. कौन है? Yeah, bro. अच्छा आप 2 मिनट चुप कर जाओ. पापा भाई बहन भाइयों को पढ़ा रहे हैं. Okay, now what happens is we are just washing the fluid from the cells, moving it into the blood, and that extra fluid will be leaving the body through the urine. And now when should not we give it? We should not give it in hypertension and heart failure, because ultimately the water is lost, but first the blood volume increases. As first the blood volume increases, if the patient is of hypertension, the blood volume will increase drastically. It can lead to anything abnormal. The heart can fail even worse. ये क्यूट नहीं है, ये बड़ा आइटम है. इतनी जोर जोर से मारता है ये. अच्छा अरे नहीं हाथ नहीं मारना. ओए क्या किया है यार, ये क्या किया है? अजान यार ना कर. अबे अरे हो जा, भाग जा यहाँ से. क्या करके अभी खा लेना. यार मेरी स्क्रीन क्या शेयर हो रही है? क्या है? यार ये लैपटॉप है. हाँ ओके. नहीं लाइट नहीं बंद करनी. अच्छा अब जाओ आप बाहर. अब आप बाहर जाए, अब आप खेलें. पापा आ रहे हैं, फिर आपको चीजें देंगे. जाओ शाबाश, आई क्रीम दूंगा. जाओ शाबाश, बाहर चले जाओ. चले जाओ. मैं करता हूँ. जाओ शाबाश. मैं आइसक्रीम दूंगा. 5 मिनट्स बाद आओ. बस आया मैं. ठीक है बेटे. सो आई गेस इट इज क्लियर नाउ. तो हम इसको इस तरह की कंडीशन में कभी भी नहीं देंगे जिसके अंदर ब्लड प्रेशर हार्ट फेलियर हो. ठीक है. एनी क्वेश्चन? एंड नाउ आई विल आस्क for you to just take a screenshot of it. You can just take it. आपको नजर आ ही रही होगी. And the tasks which I would like you to do is here. I've written down already, because in routine I usually do it in this way. Okay, what will happen if we give these two things? Number 1, if we give blood, and number 2, if we give some time. It will take some time. And now look here. In this solution,